Hi there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about retinopathy of prematurity, ROP. Retinopathy of prematurity, ROP, is an eye disease that can affect babies born prematurely, especially those with low birth weight, causing the blood vessels in the retina to develop abnormally. Factors contributing to ROP include premature birth and low birth weight. The earlier a baby is born and the lower their birth weight, the higher the risk. High or fluctuating oxygen levels. Oxygen therapy, while crucial for premature babies, can disrupt normal retinal vessel development if not carefully managed. Other health problems, infections, respiratory distress syndrome, intraventricular hemorrhage, and other complications associated with prematurity can also increase the risk. The only way to detect ROP is through a dilated eye exam performed by an ophthalmologist experienced in ROP or through images obtained via RetCam and read by the ophthalmologist experienced in ROP. Screening guidelines recommend exams for infants born before 30 weeks of gestational age or weighing less than 1,500 grams. Between 1,500 and 2,000 grams or over 30 weeks with other high-risk factors. The first exam typically occurs around 4 to 6 weeks after birth, which is often around 30 to 32 weeks of gestation with follow-up exams scheduled based on the findings. An ophthalmologist will classify ROP into 3 zones and 5 stages. The zones are determined by the location of the leading edge of retinal vascularization. Zone 1 is more likely to progress to advanced stages and require treatment, while ROP in Zone 3 is more likely to resolve on its own without intervention. The stages are as follows. Stages 1 and 2, mild to moderate ROP, which often resolves without treatment. Stage 3, severe ROP that may require treatment to prevent retinal damage or detachment. Stage 4, partial retinal detachment, requiring urgent treatment. Stage 5, total retinal detachment, which even with treatment may lead to vision loss or blindness. Treatment options include laser treatment, injections of anti-VEGF injected into the eye. Eye surgery such as scleral buckle surgery or vitrectomy may be necessary for retinal detachment. Long-term effects. While many infants with ROP recover without lasting visual problems, some may face long-term complications including retinal detachment, nearsightedness, amblyopia, lazy eye, crossed eyes, glaucoma, blindness, in severe untreated cases. Therefore, regular follow-up eye exams are crucial throughout childhood and even into adulthood for individuals with a history of ROP, whether they receive treatment or not. Be sure to subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.